So just like with diabetes, where the blood vessels inside of the eyes can be affected um, through a systemic disease, it's the same thing with something like systemic hypertension or high blood pressure. If someone has high blood pressure, then that will manifest, and we can see that in all parts of the body. And as the blood vessels inside of the eyes are the only ones that we can see non-invasively, then we can see certain changes. And some of those changes might be the appearance of those blood vessels. So there may not be any bleeding, but those blood vessels start to change the way they appear. So um, they might start to press on each other, for example. So if I have an artery and I have a vein underneath that artery, and this artery starts to thicken, it's going to push against that
Mm,
vein. And if that occurs, then we're going to see characteristic changes when we look inside of your eyes, because we're going to see that that is pressing. We're going to see that the shape of that vein changes that little
mm,
bit because it's being pressed on. If we have a look at other blood vessels that are not pressing on it, we might see that they've become a lot straighter, or in, um, because the walls are thickening in there, and there are changes that are occurring to those blood vessels. In more advanced cases, we can see that there will be some leakage or some bleeding. Typically don't see that as much as we do as with someone with diabetic retinopathy, but I've certainly seen some people that have had that bleeding associated with high blood pressure. And it's a different type of bleeding to diabetic retinopathy, because the blood vessels that are bleeding are different. And so the bleeding looks a little bit different. In some cases, we can have occlusions of those blood vessels. So something called a vein occlusion. I actually saw two yesterday, where someone's vein had been occluded, and there was a whole heap of hemorrhaging and bleeding all around that vein. And the reason that occurs is because when the artery is pushing on that vein, that blood flow doesn't really move. And so we have what's called stasis. And so stasis means that that blood is not moving, it's pretty still. And when that happens and there's not that blood flow, which there should be, then similar to diabetic retinopathy, we will have damage to the inside of those blood vessels. And part of that is because of oxygen just not being able to be transferred because it's not moving.
mm,
So when we have damage to those blood vessels and we're due to an occlusion, then there's going to be a lot of bleeding as a result, because that blood vessel is not working so well. So in some cases, that can occur to what we call the central retinal vein. And if it occurs to the central retinal vein, then that is going to pretty much affect all of the veins inside of it. And we will see hemorrhaging and bleeding everywhere. If it occurs to a smaller subsection, so a branch, we would refer to that as a branch retinal vein occlusion. And so it's not affecting everywhere, but it might only affect a certain vein. That is where the crossing is. So it depends where that crossing is. It depends where that artery is pressing. This is not exactly hypertensive retinopathy, but it is a type of retinopathy that can be secondary to these hypertensive changes, because a vein occlusion is secondary to something to do with the arteries. And so the arteries will change their shape, change their caliber, their thickness with something like high blood pressure, something like high cholesterol, and what we refer to as atherosclerosis or arteriosclerosis. It's a different entity. And these sort of changes we can detect. And ideally, we want to detect them before they get to that sort of level where they are actively bleeding, or bleeding first and then actively bleeding if not controlled. Unfortunately, we can't always detect that ahead of time, because sometimes the symptoms just aren't there. So the two people that I saw yesterday came in and saw me, and they had no issues whatsoever when they came in. When they sat down, they were not concerned at all by their vision. They were happy with their vision. There was no issues with peripheral vision. There was no issues with central vision. Everything was fine, and it was more of an incidental finding that I had found. Just found, oh, there's a whole heap of blood here. And you investigate that further and you work out why they have this bleeding. So what we like to do is ideally detect those small changes, detect
mm,
those little changes in the blood vessels, the little nicking, is what we refer to, nicking of those blood vessels. And if we see this, that's when we need to have a discussion about blood pressure.
Mm.
or cholesterol, as the case might be in different situations. And so often what I would do is I'll write a letter to the doctor and I'll say, look, this person has come in and seen me. This is what I have found. This is most likely because of blood pressure being elevated. In a lot of the cases though where I see that, someone is already under the care of their doctor. They're already taking their blood pressure medications. They measure their blood pressure and they know they are now in a pretty safe range. And so in those cases, I'm less concerned. I'm more concerned with the people who had no idea. Those
Mm.
people who have high blood pressure without realizing it, those people who haven't been to the doctor, or the doctor's been monitoring it, but the patient's been reluctant to start some medications, which is completely fair enough. But then when we start to see these changes, that's when we might need to have a discussion about, well, maybe we need to start doing something. Um, or sometimes it's just to realize that this is now a driving factor to go and see the doctor. There's plenty of people I see who haven't seen their doctor for
Right.
a long time because
Right.
nothing's been wrong until we find something like this.
Right.